All righty, I want to welcome everyone. I'm Stephen Procopio. I'm the president of the Public Affairs Research Council of Louisiana. PAR is a nonprofit, nonpartisan state policy research organization and watchdog. As part of our monthly webinar series, today we're going to be looking at Louisiana's healthcare worker shortage. As the American Hospital Association said, we will have a national shortage up to 3.2 million healthcare workers by 2026. Today, we want to discuss what the impact is on Louisiana, how bad the problem is, and explore some of the solutions. So I want to thank everyone that's joined us. Particularly want to thank our wonderful panelists. We have Representative Dustin Miller, who is not only a member of the House Health and Welfare Committee, he is also a nurse practitioner. So you can give us some double different perspectives on what's going on. We have Wendi Palermo, the Chief Education and Training Officer for the Louisiana Community and Technical College System. And we have Missy Sparks, the Vice President of Talent Management and Human Resources at Ochsner Health. Full disclosure, Missy is my sister-in-law, but I promise I won't go any harder on her because of that. So basically how this is going to work, we're going to have a few introduction questions, and then we're going to turn it over to y'all, and I'm going to turn it over to Melinda. Y'all put your questions in the chat or in the Q&A section. We have actually moved to a slightly longer format because we kept running out of time to get to everyone's questions, and that kills us. We want to make sure everyone gets your questions in as soon as possible, just to make sure we can kind of get there. Broadly speaking, I want to talk about the issues, how big the problem is, defining the solution, and then we can kind of narrow in on what the different possible solutions are, from the provider perspective, from the education perspective, and from the policy perspective. So with that, Missy, I'm going to start with you. So how bad is the shortage? How is it affecting Ochsner? What shortages are the most pressing for y'all? Is it doctors? Is it nurses? Is it behavioral health, respiratory techs? Let us know sort of from the perspective of the providers, how bad is this?
Well, thank you, Steve, for inviting us to share this need as well with our state. So much like you suggested earlier, there's a 3.2 million shortfall of nurses nationwide. And Ochsner, like other healthcare providers throughout Louisiana and the nation, we continue to face an alarming shortage of nurses practicing in our communities. And it's certainly an area where we recognize our rural and underserved communities throughout Louisiana. They're the hardest hit. And that is certainly something where we're thinking through, and we've made efforts to address these shortages, yet we still have nearly 1,200 openings for registered nurses to fill. A lot of those right now are being supported through agencies. So nurses who will take, if you will, join an agency, and we are then employing at an incredible expense. And that in the result of that reliance on agency nurses is significantly going to drive up the cost of delivering care because it raises labor costs significantly for your healthcare providers. We do have shortages, though, in other areas. When I think through certified nursing assistants, through respiratory therapists, rad techs, there are other areas in the allied health where we are also short, med lab techs, med lab scientists. And then on the physician side, we also, again, see a shortage there. In fact, there was a study that came out in 2021 by the American Association of Medical Colleges that projected the physician demand will grow faster than supply. And that projected shortfall can vary anywhere between 37,000 to 124,000 physicians needed by 2034. And AAMC estimates that Louisiana will rank third in the nation for a shortage of physicians by 2030.
So let me ask, on the 1,200 nursing opens, that's for y'all at Ochsner. That's not the state.
That's across our Ochsner and its entities. So like we'll have OLHS is included in that. That's our facilities up in North Louisiana, as well as some of our partner organizations that we manage.
And then
so that's over 47 different hospitals.
So for those positions, is that like 10% higher? How much higher was that place than before COVID?
Typically, so right now we have roughly about 600 RN agents in our workforce. Pre-COVID, we maybe had 80 to 90.
Wow. Okay, so much higher.
Significantly higher.
Great. Okay, Wendi, it's like you might even need to talk just a little bit about LCTCs. I think a lot of people, they think of nursing schools. Some of them go to the 4 years, whether it's Southeastern or Northwestern. But I don't think people realize quite the impact and the importance y'all play, and really all the health positions, nursing, not just that, all the allied health. Tell us a little bit about the sort of services you provide. And then if you could talk about, do y'all have any problems getting teachers, or has enrollment changed? Has it surged pre-COVID, or has it kind of dropped off? Just kind of give us perspective, what's going on in the educational community.
Absolutely. So you're absolutely right. And I'm speaking from experience, nursing, and when you think of a registered nurse, I think a lot of people do think about, oh, I must go to a 4-year, but you're absolutely right. We have RN programs within LCTCS. Those are, I can name them all. We have a new one standing up at North Shore Technical Community College there on, in Hammond at Lacombe campuses. So we're doing what we can to expand the number of RN programs. And then, of course, of our 12 colleges, all 12 offer LPN programs across the state. And what we're trying to do is to grow, to expand, to work with industry partners to think outside of the box. Because Missy says that they have about 1,000 in their system, but across our state, the Louisiana Workforce Commission is reporting, and it's probably underreported right now. I'm looking at the numbers, around 6,000 openings for registered nurses alone. And then in the LPN space, somewhere between 1,300 and 1,400 current openings. And like I said, that's probably a little underrepresented as far as what the true need is. So LCTCS, we can help in the CNA space. We have respiratory therapy programs, PTA programs that we do, rad tech, surgical technology. So the allied health, there is a space for someone who's interested in entering the healthcare, whether it be at a very early credential like certified nurse assistant, or if they're already a certified nurse assistant, they can become a medical attendant, which means they can work in a long-term care facility and help, distribute medications. So we're thinking outside the box. We're certainly working with others, but the biggest need in our space in order to expand is exactly what you just spoke on, is the faculty shortage. With what Missy's explaining is that you have, let's start with nursing, which is probably the greatest need, right? Dr. Sparks is going to be in the nursing space. Well, in order to train those individuals, I need master's prepared nurses and or nurses to teach in the LPN space and to compete against those salaries that are out there in industry. It really is becoming more and more challenging to try to, recruit qualified individuals who are passionate about teaching and leading the next generation. So we're certainly working through that, and we'll probably talk about this later on, there are strategies that LCTCS, along with other institutions of higher education and even the 4-year space, about how we can be flexible, what we can do by maintaining the standard of our profession and education, but also opening up the pipeline for those who want to enter. Because as it was told to me not too long ago, if you can't keep something hidden, just put it out there. We turned away as a state over 1,000 qualified nursing students. That means they were interested in becoming nurses, and we didn't have the faculty in order to take them in. So we certainly need to do what we can. I keep saying this all the time, threading that needle of, getting students into the pipeline, holding the standard, keeping them in the program, supporting them through whatever they're going through so that they can be successful, not only on the program, but on that licensing exam.
Right. No, I think that's a vital point. Yeah, thank you for your point. I think that everyone looks at the, on the back end and see what the shortages are, but we need to look and see, well, then how about all the faculty that have to teach that? So I think, thank you for bringing that up. All right, Representative Miller, I'm gonna ask you to put on your nursing hat. What are we missing? Tell us what this impact is on the front lines. Missy kind of talked about it a little bit, but what is the impact in the rural areas? Just anything else that is a catch-all that the people listening need to hear about in terms of the size and impact of the shortage before we get to the solutions.
So I was prepared to tell you some solutions. Stephen, listen.
Oh, well, look, we spent a lot of time on that. You're going to be #1 star when it comes to solutions.
Listen, I think Missy and Wendi, you're probably going to hear us all echoing the same thing throughout this whole conversation. But listen, in the rural areas, you're seeing the same impact. You're seeing a shortage, so you're seeing more agency nurses. And what does that mean in a rural area like Opelousas, for instance? It's a small community hospital who normally when you go to the ER, you know who's the nurse treating you. Well, during COVID, you noticed the big shortage. You had nurses leaving here to go to hospitals 5-10 miles up the road because they were getting a agency contract for a higher pay. So what did that force this hospital to do? They had to match it. Well, then it forced the next hospital to go up $1. So it was just like this tug of war with people just trying to staff their facilities. And then you were full of agency nurses. Obviously, you see that decreasing now, but now it's causing all of the hospitals to pay more. With that, I think Missy said earlier, the cost of healthcare is gonna be more expensive. But Stephen, basically, I think a lot of times at the Capitol, we question, are we creating our own problems? I know Wendi and them have been working hard on, and I'm getting off subject here, I think, but have been working
No, go for it.
on how our colleges, or how the board is demanding what our colleges standards are. And what that means is, how many master's prepared nurses do you have to have? Can we align that? I think our state criteria, and Ms. Wendi is probably gonna elaborate more, is more stricter than our accreditation bodies nationally. So if they don't require all of these master's prepared nurses, can we become more flexible so that we can hire more instructors, get more kids in, and try to get rid of that 1,000 students that we're turning down that are qualified, have the GPA, they're prepared to be accepted in the clinicals, but we're either lacking clinical space or instructors. So the state, we put, I think it was $5 million into like a healthcare workforce, that any college who gonna be doing an expansion project, they can apply into this fund to get it. This past year in capital outlay, we had several colleges receive some money to expand their nursing programs, and that's even gonna grow more. One of the best programs I like that comes from Ochsner, that I'm trying to get it so bad in Opelousas, but they telling me hold my horses. Y'all are piloting, Missy, a LPN program in the dual enrollment in high school. Listen, I think that's huge. You know, years back, I know when I was on the floor nurse, a lot of the hospitals went away from LPNs because I think, what is it called, blue status, or blue star status, everyone was trying to get. But, you know, we're missing a lot of LPN nurses because now you're starting to see them more on the floors. But if we can get these young individuals while they're in high school to do most of these courses, to where I think, Missy, don't they they graduate high school, I think, with maybe one semester remaining to become LPNs. That is going to hugely help our workforce, and I'm excited about that. I think Ochsner have created the blueprint. I don't know how we steal it, Stephen, or we just partner with them to get it, but I think that is a big winner for communities like mine in Opelousas. You have a very poverty area, and if we can get, you know, we're trying to get kids into the workforce. So if we can get a lot of those, we have a biomed program in one of our high schools. If we can get them doing this pilot program while they're doing dual enrollment, they graduate one semester away. Imagine the money that's going to save their families and them while they're being educated to become nurses.
Missy, do y'all have a copyright on that, or can?
We don't, but we have one of the pathways, and I know Dr. Palermo has another one that she's been working on, but all of these are efforts to do just what Representative Miller said. Let's go deeper. Let's get to students before they come out of high school. And if we can get early career exposure to those 7th, 8th, 9th graders, and then what they're able to do 10th, 11th, 12th is enter in like our pathway program for LPN or RN, that's dual approach, has a student coming in 10th grade where we're really going concerted effort around getting them with a mentor, getting them exposure to what it's like to work in healthcare. And then junior, senior year, taking those dual enrollment courses while they're in high school, so that tuition is covered. And then they do I would call it a victory lap the year after, where they're working with us as an apprentice, they're earning as they're learning. And then they're partnering with one of our LCTCS schools where they're closing either an ADN or an LPN. And it really gets them out. There's another program that I'll let Dr. Palermo share that does something slightly different, but it gets them to be LPN while in high school.
So Rep Miller, so what we did is last year, and this was the one that I unveiled to Missy during a previous webinar, was when a student is in dual enrollment, they are in LCTCS, but what we went to the LPN board, so I've got to give the LPN board props here. We went to them with this idea of clawing away real time for students who are in high school, which had never been done before, has never been done before. We're actually doing it now in LCTCS. So the dual enrollment courses that they take while in high school, they're nursing students. They are actually in nursing school. And then with that, so our thoughts were, with the help of the Louisiana Department of Ed, who we knocked on their door and said, we've got this idea, the board is on, we've got industry partners who are willing to have high schoolers. As you can imagine, Rep Miller, having a student who normally looks like a 25-year-old, and now you've got someone as young as maybe 16 or 17, it's a big difference. And so that's a lot of trust. But this is thinking outside of the box, letting them do their dual enrollment courses. Even that summer after they graduate high school, the Louisiana Department of Ed has said, we'll help cover that cost. So that student, when they graduate high school, 1 year, 2 semesters after they graduate high school, eligible to sit for licensure for LPN. And we felt that was a huge win for our individuals in the rural areas, and to get them, while they're in school. So maybe taking a history, which is great, history, math, but in a technical diploma program for LPN, those are not required. So why not go ahead and have them sit in the nursing fundamentals courses? Oh, by the way, which makes them eligible to sit for certification for CNA so they can work. And then they can, stackable credentials. And that is where I told Missy and I we do speak pretty frequently, is like, let's try it. And the Board of Nursing, I'm going to say it again, the Practical Board of Nursing, they are allowing this in a pilot phase so that we can see if it works. And so you're looking at the Louisiana Department of Ed, Louisiana State Board of Practical Nurse Examiners, LCTCS, partners like Ochsner, our long-term care facilities have all come together and said, let's try it, because what we're ultimately going to do is going to serve the patients, we're going to serve those residents, we're going to bridge people out of poverty too.
That's fantastic. And we've naturally started talking about solutions, because I know all of you came armed to talk about that, which is fantastic. So why don't we go ahead and just shift over and continue this conversation. I'm also going to have Melinda take over, and then we're starting to get a few questions in there. But let's focus on, all right, we all realize this is a problem. We knew that before coming in, but I like that we outlined it a little bit more. And let's talk about these type of solutions as dual enrollment, getting more faculty, and seeing what we have to do and where the bottlenecks are too. I think that's the same thing as figuring out solutions. So Melinda, I'm gonna turn it over to you.
Okay, thank y'all. If anybody has any questions, just a reminder, you can drop them in the Q&A or the chat. And the earlier you get them in, the more likely we'll actually get to them. So Wendi, let me start with you. In terms of the legislative funding, there was about $25 million in federal pandemic relief money that the legislature put into workforce training that was, I believe, sent to LCTCS to specifically look at healthcare workforce shortages. Can you talk a little bit about how that money is being spent? Is that to do outreach to students? Is that to try and attract more faculty? Sort of just walk us through how that money is being used, and if it was flexible enough for the purposes of what y'all are looking to do here.
We do think that, yes, we were, the past legislative session was wonderful in that they recognized that we think that LCTCS having a track record with the HERO funds and things, that was the monies was run through the Board of Regents. So, but the Board of Regents, the first round, let's say, of the HERO dollars was that money was fronted to the colleges or universities up front. But the return on that would have to wait, for a student maybe to get through a baccalaureate program or through an associate's degree program. You wouldn't see the results of that until years later. And then LCTCS said, okay, the model is good. It's a 3-year average, but the colleges will be incentivized or rewarded based on the number of students who were, one, successful in the program and on NCLEX. So then on the flip side, using that same formula from Regents, because the colleges were familiar with it, but said now the dollars will be given based on your success in the program and the success of the students, because we're trying to respond to industry. We want those who go to work for Ochsner to be able to say, as a result of these dollars, Ochsner, we went from graduating 50 to 75 or 100. And that's when the colleges can then, see the dollars that will help incentivize. And so right now we're putting out more. Our goal in the first year is about 2,000 more than what we typically do. Our goal is a 50% increase. So I tell our colleges, this is hard for our colleges. This is tough because it's recruitment, it's getting those students in, It's retention of those students. So you're helping them be successful. These students have proven that they can get in. We're going to retain them. We say, hold the standard, coach them up. Let's get them into the workforce, meeting the standard. We certainly want to graduate them and pass boards or certifying exams, whatever there is, so that they're eager to go. I'm looking at Missy, it's Ochsner, but all of our industry partners. Maybe it's North Oaks, or it's whoever, maybe it's Caldwell Memorial in Caldwell Parish. So we certainly want to make sure that you're seeing the results of those dollars. We're not using it to build buildings. We're not using it to do anything. We want our students, we want more students, and we want more students to graduate. And that's kind of been our goal and our commitment to our industry partners.
Okay. Missy, let me ask you this. In terms of the role of hospitals and healthcare facilities, what do you see the various healthcare facilities, what is their role to play in addressing the shortages? Is there a specific area that you think y'all are best focused to tackle? And are there specific bottlenecks in the education or training pipeline that inhibits your ability to attract people?
I think that for us, we have a commitment to addressing economic and health disparities in the healthcare workforce, and that is certainly a role that I believe our health providers can provide, helping to bring in more underrepresented groups into internship programs in high school, getting that early career exposure into apprenticeship pathways. Those are ways we can diversify and build that workforce. So that is certainly something that we endeavor to do. We are a partner to our colleges, so we have really taken on a far more concerted effort of saying, colleges, we don't just wait for you to hand us a finished product. We want to come to the table and be there at advisory councils, but we also want to share with you, here's what our forecast looks like. Here's what we're going to need over the next 5, 10, 15 years to make sure that our Louisiana citizens are being cared for with high quality care at the right level at the bedside. So you have to be a partner back to the educator so that they know what they're training toward. And then we want to make sure that they stay apprised of, here are the opportunities and changes that are coming and how people practice with us, because healthcare changes near daily. The way we practice changes, curriculum has to keep up. So we are in that way a partner to LCTCS, to our other colleges that we look to help build this pipeline. So for me, it's open communication. It is forecasting the need and making sure you're serving as a partner so that when we come to Dr. Palermo and say, hey, we're looking at starting a high school pre-apprenticeship pathway, and here's what we want it to accomplish, we're getting more minds on that work, collectively endeavoring, and they're helping to lift. All right, got it. We need to go partner with LDOE now. Let's get with Cade. Let's go get with Kimberly Hunter Reed, and let's go meet with this table so that we have the right stakeholders at the conversation, helping to drive change.
And Dustin, let me bring you in here. What's the legislature's role in this from your perspective? Obviously, the state and federal governments have spent a lot of money on healthcare, but do you see that the money goes to the right places? And what do you see as the legislature's role to address the shortages?
So listen, I think over the last few years with leaders like Missy, Wendi, Dr. Sullivan, UL nursing program, Southern, and others, I think we have showed that we're willing to invest. They have showed that they're going to be as creative as possible to attack this nursing shortage. One thing I personally would like to see happen is a lot of times Wendi, and I keep using her like she is Miss LCTS, but someone go there to get their associate's degree, right? You want to go now and get your BS in. A lot of these 4-year universities aren't accepting all of the credits from the 2-year university, which I think is just ridiculous, right? Now, there are their reasons for it, but I think if we can also bridge some of those gaps. I think UL made a partnership deal with SLCC recently. I'm not sure if nursing program was included in. I think it was engineering. I think nursing was too, to work hard on accepting those credits. I think that's a huge thing that legislative wise we can continue to push. But I think we've showed that we are committed to working with the nursing programs to, number one, help them expand, And number two, just try to give them the funding that they need to grow.
Okay. We're getting a lot of questions from the folks who are watching and listening. Some of them are fairly technical, so bear with me here. But I'll start with this one. Since nursing faculty availability is such a major issue, how can academia compete with the compensation that nurses receive in practice to attract more nurses to actually want to teach? And then I'm going to add on a question, which if you're trying to attract more nurses to teach, doesn't that worsen the shortage in some other ways? I mean, there's a natural tension there in my mind, but so I don't know who wants to take that one about how can academia compete in terms of getting the compensation needed?
So I'm going to jump in, and then Missy, you can, for us, I think what happened just recently, ours was originally the master's prepared RN to teach in our RN program. So I took a minute and I bragged on the LPN board, but now I'm going to take a minute and pause on with the RN board, and I in transparency am on that board, and I may have led the task force, but that's neither here nor there. It was because we needed to look at ourselves. The master's is important. I will never go down in history as the lady who does not vow. I have a master's. I'll start with a 2-year RN degree too, by the way, and then BSN and a master's and a doctorate. So it is important that they have a master's, but right in the state of Louisiana, Rhett Miller's right. We had a 20% cap that meant that only 20% of our faculty could have a BSN in order to teach, and then they had to pursue a master's. So the board, took a lot of time, heard a lot of feedback. What is this number? Where did it come from? Is it a barrier? And the board voted to remove the 20% cap, but did not remove the requirement to eventually earn a master's degree. So that for us means that now we're able to recruit, maybe there is a baccalaureate prepared nurse who would like to teach, but didn't want to make the investment in earning a master's because, so that's kind of what I want to say. The board, I think, did a great job. It was not easy for the board. It was a very challenging, there was a lot of questions, but so that's how education can now compete. We can get in a BSN and Rhett Miller, and we're going to use some of those dollars to pay for those nurses to return and earn a master's. We're going to turn around and invest in them. And then I think, and the way we look at it, I'm looking at Missy, is that she understands in order to meet her need, we gotta have faculty. So, if they're adjunct, so they're working full-time for her and they're part-time for me, but they're getting us through our clinical students and they're giving them work release time or they're sharing back. That's what we're doing because it's meeting both needs, right? To get those students into the pipeline and out. And I think Missy and I both see the value in that. But I do want to just acknowledge that the board did do that recently, and our hope is that we're going to expand taking in clinical students for the fall, starting now. We're already.
Dr. Palermo, let me ask you to clarify because you kind of the sound dropped off for me for a few seconds. So there was a master's requirement for the faculty.
Yes.
And then what exactly did the board do? They said you can waive that as you start to come on, but you have to earn one. I missed exactly what they did.
Okay, I do apologize if my sound dropped off. There was a rule that said only 20% of your faculty could not hold a master's. And if they didn't hold a master's, that 20% must be in the pursuit of a master's.
Okay.
So the board voted to remove that 20% and to allow programs to hire more nurses at the bachelor's level, at the 4-year level, so they can come in and teach.
Okay.
Now, we're not moving toward, LCTCS is not moving towards 100% baccalaureate. That is not our intention. We're just trying to get those students who are interested in becoming a nurse, get them through our programs. If the 4 years choose, we use ACEN, which means that we just have to follow our state's rules, and now there are state rules. So now we can open up the gates a little bit wider. And then while we're talking, taking those faculty, making sure they know, hey, you got to get a master's. We're going to help you in that with tuition.
Okay. So they still have the pursuit of master's requirement, but
Yes.
the arbitrary sort of 20% number
Yes.
that has been waived. Okay. Thank you.
And
That
that's a big win for our schools, a very big win. It's also a big win for us in industry where we've seen a number of seasoned nurses perhaps exit the industry after the onset of COVID. One of the things that we can now do is extend clinical faculty to our state colleges and institutions so that then they're still getting their nursing industry pay, but they can also support the education of the next generation of nurses. So it opens up more opportunities. And then we're also funding scholarship for right now, I think we have 7 MSN students who are active RNs with us in our system, where we're providing tuition in exchange for their commitment to serve back as educational faculty with our colleges.
Okay, we have a question, and I'm going to direct this one to Representative Miller, and he can punt to somebody else if he doesn't want to take this one. But we got a question about how can state community health centers become industry partners to help dealing with the workforce shortages?
I think what community health centers can do is allow for clinical sites. There's always, the colleges are always looking for more clinical sites for their nurses, for their medical assistants. And the more you open up your clinic and for your nurse practitioners to come in and follow other nurse practitioners or providers. So I think the more community centers do those type of things and allow their facilities to be used as training sites and let their staffers train nurses, that'll definitely help with the shortage. Believe it or not, a lot of nurse practitioners are in school now and struggle to find preceptors. You have to have so many hours with a GYN. You have to have so many hours with primary care, gastro, etc. I was lucky, like for mine, the only person, well, I went to my OBGYN, and my wife is OBGYN, and he said that he only takes like his patients. So, you know, I felt bad for some other people who were looking, and he wouldn't take them if he didn't know you didn't use his patient. And like, I get it, they're busy. Sometimes they don't, you know, if they don't know you, they don't have time to just take anybody. It's not like they get paid for this. So I just think community centers and other providers just helping to let people shadow and do their preceptorships.
Makes sense. Missy, this one is for you because it's Ochsner specific. Is Ochsner working with other health systems to spread and scale what Representative Miller suggested doing in Opelousas, that program that y'all are talking about, like a statewide approach, possibly? Is Ochsner, are y'all going to build out that program that y'all are working on?
We definitely do partner with other health systems on workforce development. We recognize that what we're trying to do is build the overall pool. The talent pool needs to be there so that our patients across the state can be served. So it is a great combination of efforts. So we'll work with Louisiana Hospital Association, LHA will help us also to spread messages to other healthcare entities. And then we'll work with LCMC Health, we'll work with Our Lady of the Lake. So we do have partnerships there for that particular pre-apprenticeship pathway. We have not, because it's a pilot, but once it gets scaled, we're more than willing to work with others. And that's part about setting that model, and that model can be recreated across the state in any area.
And what's the timeline for the pilot program to determine if it's a good program that y'all do want to scale out?
Our current students for our first program are in their junior year, so they're now in their dual enrollment courses. So we'll start seeing they're doing their signing day coming up March 29th, where they'll sign letters of intent to become LPNs or RNs as they journey forward. So our hope is to have some good evidence back in the next 2 years.
Okay. Wendi, this one may be for you, and if not, let me know. Somebody's asking if anyone can speak to what's being done in the mental and behavioral health space, that there are obviously shortages in those fields, but this person is saying there doesn't seem to be the same degree of leadership by universities on that front of dealing with the shortages there. So can you talk about what LCTCS may or may not be doing, or what you see as the need for dealing with the mental and behavioral health?
I did not plant that question, but I love it. So I don't know who's reading my playbook, but we do have colleges. So for those that may or may not know, we also work in the non-credit space, so the workforce. And so we too have seen there's a growing need in that sector. And so we have, right off the top of my head, I know BRCC, Baton Rouge Community College, is starting a program in their non-credit space. They're committed to their industry partners to explore that. And I think they've already started that program and de-escalation and then certifying and training in that area. And then North Shore Technical Community College at the Lacombe campus, I believe it's at their Lacombe campus. They are also interested in this. And then taking that information or that learning, that training, if there's a certification, and crosswalking it to the academic side. So if and when that individual chooses, maybe they want to go further their education, to try to link that or braid that training into something on the credit side as well to help them, you know, so they don't feel like they've lost that. But we think it could be a great first step, even for our individuals in adult ed. You know, maybe they don't have a traditional high school diploma. Maybe they're pursuing their high step. We always want to braid a credential of value with them to really raise their confidence and say, hey, you got a credential of value. We know these industry partners are looking for this. We certainly will make that connection and then hopefully inspire them to continue into education, whether it be with us or with our four-year partners as well.
Let me follow up real quick, just because I think that raises an interesting question. I think the nurses and doctors, they get a lot of attention in terms of, you know, when kids are growing up, they hear about these, but they don't hear about health and behavioral or respiratory tech and all the other allied else. Is there more of a need to sort of promote this earlier on, or how do we get people interested in things that might be a better fit for them and we desperately have a need in the state?
Well, yes, I think that, and this is maybe my personal opinion, and you guys chime in too, but I think whenever a young person thinks of healthcare, they think of doctor and they think of nurse.
Right.
And there's so much more out there. Like I really, you know, my mother's a nurse. I'm a nurse. I got a sister who's a nurse. I got a brother who's a pharmacist. You know, so we're in healthcare. But even as a young person, as a young female in the rural areas of Region A, it was you were a nurse or a doctor or a teacher. And so, yes, we could probably do a better job in just some exploration in the allied health. I think surgical technology is one of the coolest degrees we have. I really do. I think if you want to start off with sterile processing, you know, get someone exposed to the surgery area, get that credential of value, know they can go out and get a job and right out of high school or in high school. I think there are high schools that do a great job with pharmacy tech, but also knowing they can't sit for the certification until they're 18, or they think, oh, I'm going to be a CNA. Well, not everybody wants to be a CNA. They think those are the only pathways. And so I think EMT is, I'm just going to keep using the word cool. It's a great, so maybe it's that EMR, that emergency medical responder. We braid that with our adult ed or our high school students. And it's the first rung on that ladder to a stackable credential that could lead to an RN. It could lead to medical school, you know, depending on, you know, your path. Right. And so I think just getting them in a credential of value, whether it's in, you know, pointing them towards respiratory or rad tech, or like I said, you know, surgical technology, that's an associate's degree. I think sonography is a great one too. I could talk all day about sonography. But anyways, yes, I think if, you know, we need to work with our Louisiana Department of Ed and talk about it. And we're doing that. And certainly letting you know, we're working with Miss Erin Landry, who is at LCTCS, who oversees our adult basic ed program at the state level. And she is knocking on my door daily. Hey, I want this credential. And I think the IT, I know we're here for health, but you know, IT is a cool sector too, to braid, to get them up and in the workforce, and then just continue to.
Right. It's not like healthcare doesn't have IT needs. So
well, thank you for that. Exactly. They don't think like that. So yes, anything.
Yeah, we have probably, just for Ochsner, we probably have the state's largest IS unit. We have about, you know, close to 1,000 team members in that area. Yeah. And that's everything from cybersecurity to tech support and help desk and our electronic medical records. So there's a significant amount of resources that are used there and intellect that's needed. But the earlier we can do career exposure and showing people both the breadth and depth of opportunity in healthcare, we know that this is the fastest growing area by BLS or healthcare jobs. They still outpace most others. So as long as that is true, we're providing significant opportunity for our youth and our citizens when we show them the world of possibilities. And there
Okay.
hasn't been ample funding to show the possibilities.
So I got us off track. I thought it was an important, good discussion, but
It is
Melinda, get us back on track.
Let me go to Representative Miller on this. We have some questions about sort of ideas for how to deal with training and recruitment and retaining talent. So, where do you see areas that could be financed, that could be helpful here? Should it be scholarships for rural service or loan forgiveness for people who want to train in high need areas? Is it more funding for dual enrollment opportunities? What do you see as perhaps, the most value for state spending on this kind of area? We need you to be off mute, please.
I'm sorry. You asked a lot of questions there. So I don't know if you're talking about providers or nursing programs, but yes, we obviously doing loan repayment programs for providers. There's always been some on a federal level for nurses. I think one was a Perkins loan. I think if you worked that's if you was getting financial aid. If you worked like 4 years, I know when I was in school, they would every year they would reduce 20% of your loan, but that was federal and not state. But just this year we did for physicians a rural repayment program. And I think what we're doing now is going to work. I think we just have to do just what happened and continue to work with the board. Those things doesn't happen overnight. It does give the board heart pains to change rules that have been in place for 20 and 30 years. But I commend them, the nursing, the LPN and the RN board, for being creative and working with the higher ed institutions on making the changes that are necessary. But I think as far as legislators, we just need to continue doing what we're doing, opening up pots of funds and showing these institutions, if you show that you're educating more nurses, then we're gonna let you have access to these funds. Instead of just picking winners and losers, we're gonna say, hey, you're showing us that you're expanding, showing us that you're hiring more instructors. Here you go. I don't know if you agree, Wendi and Missy, but I think we're doing the right things now. That's going to work. The dual enrollment, we have to give it more time to play out. It's a pilot program. I think that's going to be a major game changer. I can't wait till we see that it work and can duplicate it over the state everywhere.
Obviously, dual enrollment is one of those things that in rural areas, it's hard to get access to sometimes to some of the classes. I know that's been a big point of discussion. So it does seem like that would be an area that would need to be thought through of how to get more access in the highest shortage areas of the state.
I could agree with you. It would be challenging, but think about it. Like I know from my district, in poverty area districts, if you can reach those kids while they're in high school, I think you show them that they can be successful. They can have great careers for the rest of their lives. I find that once they leave high school and that yellow bus stop picking them up is when you lose kids. So I think that just having these kids 1 or 2 semesters away from having that LPN certificate is just gonna raise the bar, change the game, and then also add more people to the healthcare workforce at the same time.
Wendi, let me ask you this one. Somebody's asking, what's the possibility of the state providing scholarships for medical assistants wanting to become LPNs and then bridging over? Perhaps schools with nursing programs could offer stipends to assist with the cost of the program. Does LCTCS do any of that right now? Is any of that in the thought process?
Well, you got to remember too, we have the MJ promise too. If they're a certain age and it's a short-term credential in a high wage, high demand sector, which healthcare is, they could be, depending on their age and their history, there are available dollars to support that student. But it also, this is where I don't know if I'm a surprise Missy or not, but we had the State Board of Nursing heard of, so let's say you have a student, Rhett Miller in Opelousas, who does the LPN through dual enrollment and they are successful. But you know what? That was just the first step. They really want to be an RN. So Bossier Parish Community College brought forward, not once, but twice, in working with a board who was very supportive. What about a true LPN to RN apprenticeship where they're working as an LPN, let's say in a hospital in Bossier, earning, and that time is going towards their clinical hour requirements for the program, for the RN program. So that's never been done in this state before. And I'm so thrilled with Bossier Parish Community College and hearing that. So we're talking about a true apprenticeship, and then also notifying the Louisiana Workforce Commission and working with that sector to talk about, you know, what's it going to take to get an LPN to RN program registered apprenticeship. And so having those great conversations. And then I want you guys to know I'm getting tapped on the shoulder by other colleges going, hey, we want to do that too. What, you know, what's it going to, you know, what will that look like? And so really proud of Bossier Parish Community College thinking outside of the box, because that's not just, okay, now you're earning money, you're making good dollars, and you're working with a college. And of course, it takes the employer, the industry partner, to work with that person. Because Brett Miller, you're absolutely right. There was a season where hospitals were not hiring LPNs, and now you're seeing them on the med surg floors. Those are great candidates, excellent candidates. I think they'll do very well on boards. And so that also is going to be kind of our pilot. So that's another one that we're doing in LCTCS, to think outside of the box. So,
and I'll just piggyback on that, because we do have a registered MA to LPN apprenticeship in partnership with a number of different LCTCS schools. So we've run it with Delgado, we've run it with North Shore Technical Community College, and we have an registered MA apprenticeship we've run with SLCC. So we do very much believe in that model to help build the workforces. You can even begin with your incumbents who are already working with you, and upskilling and bringing them to the next level. So the more that we can get that movement happening, the more we're going to see that upper level pipeline expand.
Right. And then here's where I'm going to brag again, both boards, you know, the RN is excited about hearing that. And then that very day after the RN board heard it, I was reached out from the LPN board, who said, hey, we want to do this too. And so we're thinking CNA to LPN apprenticeship, which has never been done. So that would be fantastic. So then you've got individuals who can continue to work in their industry at their job, but also pursue higher education without so much disruption to their personal life and things. That really is an issue for our adult learners. Mm-hmm. I'll hush now.
No, we never want anybody to hush on a webinar. So we have someone, and I'm not sure who should take this, so I'll just ask the question, and if somebody feels prepared to answer it, please do. We have someone asking about the collaborative effort of the Northeast Louisiana Healthcare Alliance. And they say that the program has won international awards for its approach at provider and university collaboration, and has been leveraging philanthropic resources. And this person says that they believe that this program is producing several hundred more nurses through the effort, and other regions of the state seem to be replicating it. So is anyone familiar with how that works, and if it's being like replicated around the state, or if there is a process to do that?
You know, I can jump in here. I know that our college up there, Louisiana Delta Community College, is heavily involved in that organization, and also in partnership with ULM. So I can just speak to the things that we're doing and standing up a new medical lab tech program in collaboration with them. They are an organization that whenever we think big and think outside of the box, they have been such a huge resource in bringing and bridging together for us higher education in that area. ULM, Louisiana Delta Community College. That's my experience with them. And, you know, I got to think about it. I don't know. I'm sure that there are other great organizations, but it does seem like they are a powerhouse up there in the north. Certainly don't want to take away from what other great work we're seeing in partnerships, but yes, if we're wanting to move forward, and I'm just going to tell you, system-wide agreements for LCTCS are being run through ULM right now. First, and it's because of this excitement with that organization and saying, you know, RN to BSN all online, even graduate school. I'm going to be honest, we're working with them with Dr. Wendi Bales at ULM and a full-blown MOU to send those faculty who might be interested in pursuing a master's through ULM, working with her to make that pathway much smoother transition for our faculty, our future faculty. Very innovative up there.
Well, we have someone who said they agree with Representative Miller about having to get to students before they leave high school. And they say that the New Orleans Career Center is working with schools to do that. And that at some point they said that LPNs used to come right out of high school, and that they would like to shift back to that, and it builds pride and self-reliance. So I don't know if anybody wants to talk about what's going on with the New Orleans Career Center and how that is helping address, maybe that's a Missy question. Is that helping address?
Yeah, and in full disclosure, I serve on their board of directors, and they're an absolutely fantastic high school. So New Orleans has a significant number of charter high schools. And that means that there's not a centralized career center that existed within the parish of Orleans that could bring students in. So New Orleans Career Center was stood up and kind of occupies that space. So they're working on high demand, high wage industry pipeline programs. They have embedded there now a medical assistant program. They have another program that is for certified nursing assistants and PCTs. And then they're building in another LPN apprenticeship pathway program that we have worked. They're part of that signing day coming up March 29th with us. So they are very much taking a view of how do we help to build that pipeline, expose students to the possibilities within healthcare. And many of their MAs go on to nursing school right away. They move into Chamberlain, they move into other state colleges where they're entering those pathways post high school. So they're doing a fantastic job of making sure students have the foundational skills ready and are at the ready to compete for high demand, high wage positions with credentials and then with pathway options.
Dustin, let me go to you. I know you created the Health Disparities in Rural Areas Task Force in the last regular session to look at ways to address these shortages, particularly in rural areas. Can you talk about what the task force is recommending to address the problem, and if any of that will become legislation in the upcoming session?
So the task force is actually meeting now. I think they met yesterday to start to finalize their recommendations. But Melinda, their recommendations far exceeds just like nursing programs. It's attacking healthcare disparities as a whole.
Okay.
So I think we'll talk another 6 hours if we try to say what they're going to say. But I think the plan is we're going to try to extend another year for that task force. The amount of work they had was just so overwhelming. And so we're going to give them more time to keep working. They're working, Ms. Karen White was working with a lot of the department heads to kind of see some of the suggestions they want to do. Some of the department heads can actually make those adjustments now, and we don't have to bring legislation to make those changes. Some of them are doing some things that the committee was not aware of. So I think we're just going to continue the great work they're doing.
Look, we're always looking for other webinar topics, so maybe we'll come back to healthcare disparities at some point. Bring you back.
Let's do it. Let's do it.
It does seem like a big issue to get your arms around, so I can imagine another year of work would not be lost.
Yeah. Look, it goes all the way to poverty, to lack of access, to I mean, it's just such a big issue. I just God bless their soul for everyone that's working on that committee, because it's a big issue. And then the challenge is which one you attack first, right?
Right.
But
it does tie to pipeline as well, because the more we can make a diverse workforce for healthcare, the better we can address some of the inequity issues.
Yes, definitely.
So Missy, this may be a question for you. We have, what is the role of after hours alternative time training programs? It seems like programs like those at LSU Eunice in partnership with Blue Cross Blue Shield and Ochsner are examples of this, but there may be others.
Yeah, so part of what we're trying to do, especially when we look at working adults, it becomes far more difficult to quit your day job and go and take training. And a lot of our traditional colleges operate off of a model where you have to leave during the day to be able to take your classes. So what we're trying to do is partner with colleges to think differently about what could that be. So Wendi looked up one with ULM of some of the online pieces that they're offering. Is there opportunity for asynchronous training, learn at my own pace, at my own time? So it is very much a piece where we're trying to say, what's the right model to get more people able to access the training, to develop their skills, to earn their credentials. So it's certainly something that is needed. There are pockets of it happening, nights, weekends, asynchronous, more is needed.
Wendi, we had somebody who liked your discussion of BSN nurses being qualified to instruct and is asking about should LCTCS maybe think about giving them additional training in teaching approaches and curriculum development, or provide them with a mentor to help them facilitate the teaching and instruction.
That's a great point, but I think what we're also need to recognize is that I have baccalaureate prepared nurses already teaching in the LPN space. They just weren't allowed to teach in the RN space. So we already have nurses with a baccalaureate degree who have decades of teaching experience and understand curriculum development and evaluating program learning outcomes and student learning outcomes and program outcomes. So we wanted what our thoughts are. We'll take them, move them up, bring in another group, orient them in the LPN space, because it's just a good pipeline. So yes, anybody that we bring in obviously has, because with a master's, you can be a nurse practitioner. That doesn't mean that you understand curriculum in the ways that we have to in order to meet SAC, COC, and ASIN and things like that. So that all happens whenever they come through the door. We take time and work with them. They do have mentors that maybe co-teach with them best practices and things of that nature. So it should be a seamless transition. We do it as slow as we need to, because we want to keep them. We want to make them excited about being faculty and teaching and staying with us.
And I'm not sure who wants to take this one, but this question is, with access to care in Louisiana being a struggle and our health rankings being so low, is there a plan to support the growth of APRNs and midwives in an effort to meet the needs that exist, particularly in rural Louisiana? Who wants to take that one? Dustin, let's go with you.
So listen, the question again, did you say eliminate the barriers? Right? Is there a plan to support growth of APRNs and midwives? So listen, I think that the plans have been supported. There's rural health clinics, FQHCs opening up throughout the state. I think a lot of people are now hiring more and more APRNs, even Ochsner. So there's one barrier that some people think is the collaborative agreement. But besides for that one barrier, I think it's very supportive for APRNs and clinical midwives. And like I tell all the APRNs I speak to, the more patients we treat, the more trusted you will be, and the more understanding the legislators will be, if that make any sense. So I remember when I first got there about 7 years ago, a lot of legislators were like, no APRN, it's all about doctors. But now when their kids get sick, they're going into urgent cares, and guess who's treating them? Nurse practitioner. When they go to their physician office, now a lot of times they're being treated by the nurse practitioner. So you're seeing a lot of their attitudes and trust for nurse practitioners is changing by the day. And so I just think the more we do good work and continue doing the work we do for the citizens of the state, you're gonna just get more trust. Remember, nursing profession is the #1 trusted profession in the country. So we just have to keep doing our work. And I think any barriers we have are just gonna eliminate themselves.
If I could follow up on that, Representative Miller, the legislature is mostly full of, small business owners or lawyers, not too many healthcare practitioners. Are there particular barriers or issues that you've encountered that you need to overcome in terms of explaining some of the actual issues that y'all face in healthcare that still need to maybe be communicated more to them and into other stakeholders?
I think educating them is always opportunities. But for the most part, I think they understand. It's just really for us to be able to get with the physicians and take more of a team approach is what I've been trying to push with the physicians. It's like, look, we're not against each other. We're together. We tried to get rid of the collaborative practice agreement recently. I thought we had a deal, but it didn't make it towards the end. But even besides that, I keep telling them there are way more issues, right? Issues as far as how do we do our credentialing process with our Medicaid companies? What is the reimbursements for primary care providers? I don't think they've gotten an increase for primary care providers in years, right? We're always talking about increase in reimbursements to hospitals, no offense, Missy, and different programs that hospitals do, like physician FMPs, et cetera. But you never hear about that physician who owns their practice getting any increase in reimbursement from any state healthcare plan. So I've been trying to focus with a lot of the physicians on those issues, like there are common ground between myself representing nurse practitioners and physicians that we can work on together. It's a team approach for the patient.
Okay. We have a few questions left, but I think we're getting a little bit low on time. So let me ask one more question of Wendi. There was a question of, are there any transition to practice programs included in the work with the LCTCS pilot?
So I know that for us, transition to practice starts with clinical, and then also working with our industry partners. There's typically a residency program. I see Missy's nodding her head. We do encourage our students, if available in their area, because we do also in the rural areas. I would like for them to expand that to include LPNs in the future. I think that that's, if they're not, and maybe Ochsner is, but maybe others are not, is just to make sure that that transition is, is seamless for our individuals, because they do say that, burnout, it's a real thing. We need to show our new graduates that we are not eating our young, that we're excited about them entering the workforce and the space. And so you're absolutely right. There is a bridge that needs to always occur between education and industry for that transition for our students.
I want to thank everyone. This was, I think, a fantastic panel. We actually extended how long we normally do these in 45 minutes. We went to an hour just because we know there'd be so many questions, and we didn't get through all of them. We got through a lot, and I really thank y'all, Dr. Sparks, Dr. Palermo, Representative Miller. I really appreciate it. I think this was a really good in-depth conversation. And you talked about teamwork. You definitely saw a lot of it here. And so I really appreciate that. And I want to thank everyone that was also joining the Zoom. Y'all had get some great questions, and I hope y'all learned a lot. A reminder that we will also post this on our YouTube channel. We will share that out with everyone. So if anyone wants to go back and look at all the details that we actually went into, that would be fantastic. Next month, we're going to have a kickoff conversation about the 2023 legislative session. It is a fiscal session, but it's also an election year. So that's going to be a fun one to talk about. We'll see what Representative Miller is going to be up to. So
I need some money.
And then send us your thoughts, ideas, questions in advance. Once again, I want to thank everyone. I thought this was a great conversation. I thank you for your participation.
Thank you all.
Thanks.
Thank you all.
Thank you.